Hello, it's Dr. Rhonda Johnson. Today is Wednesday, September 7th, 2022. Today I'm talking about something very near and dear to my heart, orphan children. Now, yesterday an article was published online in the Journal of the American Medical Association Pediatrics Journal on orphanhood and caregiver loss. Now, I've talked about this topic many times before, but the authors used excess mortality data from the World Health Organization, and these authors estimate that 10.5 million children around the world lost parents or caregivers from COVID. Now, the greatest number in terms of global countries that have children affected by orphanhood include the African countries of the Democratic Republic of Congo, Ethiopia, Kenya, Nigeria, and South Africa, and the southeastern nations of Bangladesh, India, Indonesia, Myanmar, and Nepal. Why is this important? Why should we all care? Because there are lifelong consequences of orphanhood, including institutionalization, abuse, traumatic grief, mental health problems, including suicide, adolescent pregnancy, poor educational outcomes, and higher risk of sexual exploitation and prostitution. Now, the article authors suggest three essential components to address this. One is the prevention of death by caregivers. I've said this before. Parents, if you don't die from COVID, your children won't be orphans. And they suggest acceleration of vaccine uptake, containment of this pandemic, and treatment of infected individuals. Number two is prepare families to provide safe and nurturing alternative care. And three, protect orphan children through economic support, violence prevention, parenting support, and ensuring school access. Now, here in the United States, you may recall that in December 2021, CDC researchers published an article in the American Academy of Pediatrics Journal that estimated over 140,000 American children experienced the death of a parent or grandparent caregiver. Now, that was before the Omicron phase, folks, and we know that the Omicron phase of this pandemic has been associated with a higher number of deaths. Now, according to the AAP, the American Academy of Pediatrics Journal article, Black and brown children have suffered the highest losses of their parents and grandparent caregivers that are 1 to 4.5 times higher than white children. Now, this is so sad to me personally because death from COVID is largely preventable through COVID vaccination, yet millions of people remain unvaccinated. In the global South, in particular, it's a matter of resources and poor access and availability of vaccines. But here in the United States, it's a lot of misinformation. We know that the vaccines don't prevent infection, but they remain highly effective at keeping parents and grandparents out of the morgue. COVID is not over, folks. It is not too late to get vaccinated. Here in the United States, they remain very accessible, and as of today, they remain free to anyone living in the United States. Please share this video with a parent or caregiver that you know that might want to hear this message. As always, my views are my own. Stay safe, and please be careful.